It's so nice to see so many of our advocates and people and staff here. It's wonderful. I hope everybody had a fabulous day. I have the real privilege and the honor to introduce the briefing we're having this afternoon. The Eating Disorders Coalition, in cooperation with Senator Tarkin's office, is sponsoring this briefing today called The Federal Response to Eliminate Eating Disorders Act, How Congress Will Save Lives by Passing This Bill. That is so important. The will piece of that is the operative word. We will save lives. We have an esteemed panel today of people that I've known for quite a long time, and I'm really humbled to be able to introduce them. We're going to start with Dr. Jillian Croll, who is from my home state of Minnesota. Jillian is a registered dietitian that works at the Emily program. She's also our communications director and does a lot of education prevention work, travels the country and the world talking about eating disorders and educating people in all walks of life and all levels about eating disorders. Jillian's talk is expanding our understanding of eating disorders through research. Jillian has been the principal investigator in quite a bit of research. She's doing some really interesting things. She actually started and conducted, she's really afraid of what I'm going to say, we roomed last night. She did some research about treatment outcomes that has been pretty much followed across the world. And so, Jillian, I'm going to hand it over to you. Thank you.
I love when people clap before I say anything. It's the best. All right. Well, I think it's fitting that research gets to go first because I do a lot of research and I like it. But research is a word that I think sometimes strikes fear in the hearts of my colleagues. And I usually get the response something like, well, good for you that you do research. That's really important. I'm just really glad I don't have to do it. So I'm really glad that I get to do it. Because to me, research is not the dry crunching of numbers that sometimes people think of. It's not the endless surveys asking the same questions the same way over and over again, or just simply trying a new drug or a treatment to see what happens, see who gets better, who doesn't. It is some of those things. But what it really is to me is recognizing that we don't know something and finding out information about that so we do know something. So we're trying our best guess, we're asking the right questions, and really most importantly, we're listening to the answers. And I think that's the really critical piece. That it's indeed asking questions and systematically and thoroughly and analyzing all the data and asking enough people and sifting through all that to get an answer. But I think best done research is asking each question one person at a time and really listening to the answer. And that informs what we don't know. So the reality is that asking those questions in a really thoughtful, effective, adequate amount of time in that manner takes a lot of resources. It takes money, it takes time, it takes people. And the answers are then applied, in theory, hopefully, to improve our understanding of what we currently don't know. Really what it is it's an investment in our future. And that's why it's critically important that we have more of it so that we can change the future. And that's what we're all here for, right? Is to change the world. This is one of the ways that we're going to do it. So the FREED Act has a provision for expanded research funding in eating disorders, which we all want. That's an investment in our future. And today we spent the day talking about that. Hopefully we communicated that message that this isn't just about today. This is about our future because we can change that. So eating disorders impact more than 11 million people, more than 11 people, a lot more than 11 people, more than 200,000 people in the state I live in, which is really striking because when you think of a big number like 11 million, it's just a giant number. And we broke it down by state. So 200,000 people in my state have an eating disorder. Well, I work at a treatment center that treats 4,500 people. If you can do the math, something needs to change. So eating disorders aren't just about food and weight, we know that. They aren't lifestyle choices, they aren't moral failings, heard that. They're psychologically and medically complex, multifaceted illnesses. They're the most fatal illnesses of all, psychiatric illnesses, and yet we don't really know how to treat them as effectively as we should. And we need to change that. So clearly there's much more to know. And finding solutions to those challenges is really imperative. So I think about, some of those things that we don't know about eating disorders are the things that are really severely impacting and indeed killing people. And we need to know those things so that can stop. So how is it that we don't know? Why don't we know? Eating disorder research is seriously underfunded. at the federal level. It receives only a tiny fraction of federal research dollars. As a nation, we support considerably larger expenditures on research in illnesses that would have similar or even lower incidence rates like breast cancer, HIV, schizophrenia, and individuals with those illnesses absolutely deserve the intensive large-scale research that we do and that we expend on those illnesses. And individuals with eating disorders deserve the same support and the same attention. And as with this, moving, like those other illnesses, moving quickly to find more effective treatments will literally save lives. And that's what we want to do. And I want to tell you about one person whose life could have been saved by having better answers. And I just met this person's parents last week. Kitty and I had lunch with her parents, and her name is Julie. So I want to tell you about Julie. I had the fortune to know Julie just a little bit, and I knew her better through some other people, but she was very kind, very gentle. She was a therapist, worked with young people, was really a good therapist, had a strong gift for connecting with people. She grew up in Illinois. She went to college, she went to graduate school, she was really closely connected to her mom, to her dad, to her sister, to her brother-in-law, and she died this January, 2010, on January 7th. She was 31, had a 7-year battle with an eating disorder. So at lunch last week, with her parents who were there trying to figure out how to do something with their rage and their sorrow, I was struck by how many barriers they faced, and Julie faced, in the pursuit of her care. So she had uninformed physicians telling her she was just fine. She had difficulty accessing treatment in her area because there was a lack of specialized care. She had insufficient and really ineffective treatment when she was finally able to get something. And she experienced a really long, burdensome road to eventually accessing quality treatment that at that point was too overwhelming and frankly too late. So every one of those barriers we could move out of place if we just had wider spread understanding about eating disorders, about how to treat these illnesses, and had improved access to care and to prevention. So research shows that we know early identification of eating disorders and access to specialized care is paramount to recovery. If Julie's physician and her insurance company very likely would have known that, she may well still be alive today. So we have to identify even more effective ways of treating eating disorders and find the most efficient and practical ways to make those treatments available to people. And we need to make it easier, far easier, for individuals with eating disorders and their families to find reputable and effective treatments. And we need to better understand how to prevent them from occurring in the first place. And a lot of that can be done through research. It's also really critical to underscore that we have to do that all in today's climate, in today's healthcare climate. As a nation, we're very interested, I would say, in weight-related issues. Very interested. We like to talk a lot about weight-related issues, not so much about eating disorders, but a lot about weight. We have to recognize that we need to better understand the incidence and treatment and prevention of obesity, yet we need to make sure that as we address obesity, we need to be mindful of how we go about doing so. Because research shows that certain strategies that are really common for reducing obesity actually make things a lot worse rather than better. So the good news, though it made you feel really sad, the good news is that we can really likely prevent both obesity and eating disorders at the same time. So, but to do that, our strategies really need to change. So Diane Newmark-Steiner, who is a researcher at the University of Minnesota, and a colleague of mine, is conducting a fair amount of research on the intersection between eating disorder and obesity prevention that's so far yielded some pretty clear guidance on what we need to do, what parents need to do, what practitioners need to do. And this and some other research clearly shows that in order to really promote health, which is what we're all after, and reduce eating disorders and obesity, our strategies have to change. So rather than encouraging those common weight loss strategies like dieting and restricting and counting calories, adults really need to model positive behaviors and make changes in our homes, in our schools, in our communities, in our environment. And the message that Diane Newmark-Steiner and her colleagues have is really powerful and really simple. It's talk less, do more. 4 words. Talk less, do more. So talk less about what to eat, model how to eat. Adults need to model healthy eating, activity, and most importantly, I think, emotional coping behaviors for kids, while avoiding all those unhealthy dieting behaviors and using food to cope with emotions. So we need to talk less about what to eat. We also need to talk less about weight. We need to talk less about weight and do more to promote self-esteem. So we know very clearly from research that when we talk about weight, when we make weight-related comments, we make things worse. So kids who are teased about their weight have lower body satisfaction, lower self-esteem, more depression, more suicidal thoughts, and they're more likely to be overweight, to become overweight. So think about that. They're teased because of their weight. They're more likely to become overweight. They're not going to hear that information and think, oh, I should change my weight. They become more overweight, no matter what their weight is. Underweight, normal weight, overweight, it doesn't matter. So what we're doing now doesn't work. And the educational campaigns that we have that inadvertently, or perhaps purposely, stigmatize overweight people are really unlikely to be successful and are clearly have a very clear potential to be harmful. So we need to teach adults to avoid making weight-related comments, and we even today in our visits heard a number of comments in the waiting rooms. And I thought, oh, that's why we're here. That is why we are here. We really need to help people to stop making those and to really refuse to tolerate or participate in weight teasing in any way, shape, or form. So rather than measuring BMIs in schools and sending report cards home grading kids on their weight, which, as you'll hear, I think Wendy's going to address a little bit, a growing trend among states as an intervention for obesity, I think we should promote positive self-esteem by asking kids how they feel and helping them achieve their potential instead of sending home a grade about their weight. We need to take great care to ensure that obesity prevention and intervention efforts don't result in a whole generation of young people who feel worse about their bodies and themselves. It's possible to promote health and well-being without generating casualties like Julie and so many others of all shapes and sizes who struggle with eating disorders. So I think we need to do things far differently in order to promote a generation of thriving, successful young people who know that what matters most is who they are, not what they weigh. So the answers are out there for us to find if we can just commit to asking the questions and commit the resources to finding those answers. So we have to actively pursue knowing. I think it's time. I don't think there's any better time. We need to do it now. So passing free is a tangible act, a viable step towards greater understanding, and it's an action that will yield life-improving and life-saving results. So every step we take towards knowing more prevents us from having more unnecessary and frankly intolerable losses, like so many that we've all experienced. So for them and for all the many others, passing free will help their losses not be in vain. Knowledge is power, understanding is hope. Let's get this bill passed.